Okay, good morning, everyone. Can those online hear the room? Yep, thumbs up, thank you. Okay, good morning, everyone. Welcome along to our January 26 IJB meeting. We are quorum, which is always a good start. We do have a couple of apologies and substitutions. So Amanda Winters is here for Sharon Moali and Lindsay Hansford for Victoria McRae. Are there any other apologies this morning? Can we move on then to declarations of interest? Does anyone have any interest to declare in any of today's items? Nope, not seeing anything. Okay, thank you. Then the minute of our last meeting from December, run through it for accuracy first. So if there is anything in any of the pages, please shout out as I go through. Anything on page 4 of the pack? Page 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. Can we accept that as an accurate minute of the last meeting? Yeah, thank you. Okay, item 4 then is the action log. There is only one live action, which is partnership funds, which is actually on today's agenda. So I think we're fine there. We can close that one off after today. Are there any other matters rising anyone wants to raise from the last minute? No. Okay, if we're all good, then we'll move on to item 5, which is the Chief Officer's report. Gail.
Thank you and good morning. So before I start the Chief Officer's report, I just wanted to mention that last night the Falkirk Council had an awards event celebrating long service and staff recognition. So there were a number of colleagues within the Health and Social Care Partnership who received their 25-year long service award. So that's a huge achievement and dedicated services delivering health and social care to the people of Falkirk. In addition to that, the Forth Valley Child Interview Team won the Staff Recognition Award. And again, it's huge credit to that team, which is really a multidisciplinary, a multi-organisational team, really benefiting children in Forth Valley area. So just wanted to mention those two events. So I'll move on to the Chief Officer report. It's the usual format with local, regional and national updates that will be of interest to IJB members. So I'm just going to highlight some aspects of that. First of all, in relation to care opinions, so members will be aware we've been using care opinion since September 2022. We've recently evaluated the usage of that, and the usage hasn't been as high as we might have anticipated. So we've, as an SLT, agreed to discontinue the subscription, which generates savings. It does mean that people will still continue to have access to put their stories into care opinion, but there's less functionality that's available to us, and we can reconsider that, and we will review that in 6 months' time to understand the impact of that. There's also a note about the reappointment of the third sector rep to the Integration Joint Board and to the PAC Committee. So following a process conducted by CVS Falkirk, which is the third sector interface, Ian Dixon, who's the Chief Executive of FADAM, has been nominated as a proposed appointment for the third sector representative on the IJB and the PAC Committee. So IJB is asked to confirm that recommendation. As colleagues will be aware, we've recently been inspected through a test of change inspection by the Care Inspectorate. That took place between April and September 25 around care at home. So the inspection has been published since the last meeting, and the PAC committee will also be receiving a deep dive on that to fully understand the findings of that report. Overall, though, just to highlight that all areas that were inspected were evaluated as good, and we're really pleased about that. And many of the areas for improvement were areas that we were actually already aware of, and improvements are progressing well. So we will provide more information to the next PAC committee. Also, just to highlight that our Burnbrae care home was recently inspected in the end of November, and the report was published in December. So again, that's a really good inspection report, and the team there received an excellent rating for supporting wellbeing and very good rating. So we're really proud of the team there and all the good work they do to support people in Burnbrae. There has been urgent unscheduled care funding across Forth Valley, and it was agreed before Christmas that the slippage of that funding could be used to support social care. So that's been used across Forth Valley, but within Falkirk, that's helped us to support more people who are ready to come home to a suitable care environment. So that's helped us support flow across the system over the really challenging winter period. In terms of other updates, so colleagues will be aware that there was an announcement about GP walking centres. So just to provide a little bit of an update, we did put in a proposal into Scottish Government, and we're currently still in discussions with Scottish Government about that. So we understand that further information will be forthcoming in the next couple of weeks. There's been a couple of national reports which will be of interest, including the delayed discharges report by Audit Scotland, and in addition to that, there was another publication around an interactive tool which is available, and again we're bringing more information about that into the next PAC committee. In December, the Minister for Social Care and Mental Wellbeing laid regulations and the Scottish statutory instrument to allow voting rights for service users, unpaid carers and third sector representatives. That's going through a process at the moment. It's a negative procedure process, and we expect that to come into force in September 2026. So that obviously will be a significant change to the IJB, and we will bring that into future development sessions as it progresses of the IJB, and provide updates as required to the IJB. So going back to the recommendations, we're asking members to consider and comment on the content of the report, and to approve the appointment of Ian Dixon as the third sector representative to the IJB and the IJB Performance Audit and Assurance Committee for a 3-year period commencing immediately.
Thanks, Gail. Before I open up, could I ask that the Care Inspectorate report circulated to all IJB members, not just those on the PAC committee? I think it'd be good for everyone to see that. Can I open it up then for questions or comments? Councillor Hannah.
Thank you. First of all, just a comment. I attended the Long Service Awards and Staff Recognition Awards last night, and I was absolutely blown away by the commitment of the staff. And I think it's important to add that everyone I spoke to talked about how much they love working in the service. And I think it says such a lot about our staff that A, they stay so long, B, they work so hard, and C, they love their jobs. So I think very big thank you to them all. The other thing I wanted to comment on was the Burnbrae inspection report, which is clearly good, and again evidence of the commitment of health and social care staff and how hard they are working to have been able to get such a good inspection report. On a slightly less positive note, though, as you would expect, I would like to hear a little more about the GP walk-in centres. I mean, I have seen some of the coverage of it and concerns coming from GPs about it actually taking away from the focus on our GP surgeries. And I wonder if you could say a wee bit more, A, about the rights and wrongs of it, and B, about what is being put forward.
Tom, do you want to answer that one?
Yes, thank you, Chair. An interesting question indeed. Obviously the announcement was made without there having been a lot of prior conversation about it, and therefore it was for each of us to individually consider what the implications were. But I do understand that there have been kind of fairly collective conversations particularly from GP colleagues around about some of the concerns. But I suppose it's incumbent upon us to respond positively to the opportunity to provide greater access for citizens to quite quick healthcare and support whenever they need it. And fundamentally, I think we would all agree with that principle, and it's important to do that. In any circumstance, anything new like this, you would have reservations about the suddenness of it and the pace of change. And so obviously our greatest concerns that are being expressed are around about how this integrates with pre-existing patient pathways. So for example, does a walk-in centre, which means people can just fairly casually and quickly decide to go there, mean that they then don't phone appropriately for an appointment with their GP or go to the pharmacist to get the matter resolved, because this might seem like a simpler, more default thing to do. And I think our concern might be that it would fundamentally not only undermine existing and well-established patient pathways, but actually the individual may not then be going to the right place at the right time. So we have tried to manage that in terms of communications back to the government around about some of the safeguards that would need to be in place. But again, a lot of this is about the pace of rather than the fundamental idea. I don't think any of us have a problem with it, with the idea. It's just about how we find the best way of ensuring pre-existing patient pathways are appropriately maintained and support our communities the way they should do, but also add a bit of additional value. So the position is at the moment we are going a wee bit back and forward over some of this discussion. So I can assure members that all of the concerns have been taken very seriously, not only by ourselves and reflected to the government, but the government themselves, the civil servants, have taken these on board and reflected that these are concerns and conversations that are happening all over the country. So at this stage, it's still a wee bit of an unknown about what will be the settled expectation and what our offer then might be, but we're working very carefully with that. So hopefully that gives some kind of sense that we're aware of the concerns, we have reflected them, and the government have acknowledged them.
We have often heard about the problem of recruiting GPs, yes, and the fact that we have a recruitment and retention problem. Where is the staffing going to come from?
Sure.
Is a major concern. And would we not be better focusing on having a drop-in service in all our existing surgeries rather than setting up something separate?
So yes, if I can go to the latter point first, sorry, through yourself, Chair. If I can go to the latter point first, in the timeline that we have available and with the brief we have, it would be incredibly difficult to negotiate under the GMS an arrangement whereby all general practices had to also provide a walk-in centre. That would be quite a daunting task, to say the least, and certainly within any reasonable time frame would not be achieved consistently across the whole of Forth Valley. There may be ones who could quite quickly and immediately would have the aptitude and the desire to do and could do it. There would be plenty of others that just would not be possible with their existing facilities and their setup. So there would be immediately a discontinuity there and the complexity of setting that up. In terms of your first point, which is around about recruitment, there's been two sides to this. One is a recognition that actually having some kind of community setup in which it works flexibly over during the day and in the evening and in the weekends might prove an attractive proposition to available GPs out there and also other workers. In terms of you're not either locked into somebody who works during the day or locked into somebody who works in out of hours services. There's a bit of flex here. So there was an element there of attractiveness that was a possibility. The other side to that is that, yes, where do all these people come from? If there is presumed to be additionality, then is there a risk that we are merely taking from other existing services, PSIP services, acute side services, or general practice services. So we're again mindful of that, and therefore going back to the government to manage expectations, that there is not a big cohort of people sitting waiting for us to develop a service that they can then step into. If David were on the call, I don't know if David is on the call, I didn't see him earlier on, he would tell you that there are GPs out there looking for work and looking for jobs. The difficulty at the moment is the available funding and the mechanisms for all of that to actually recruit and employ them isn't available. So additional money might well mean that we can then bring in those additional people who are available. But again, it's again the complexity around about if it's a truly walk-in centre, you don't know for sure who's going to come in the door and the nature of what they're all going to come in for. And therefore, is it actually a GP orientated service? Is it a kind of broadly EHP? Is it a hybrid of the two? It's at the moment quite difficult to know for sure exactly who might use this service, although we have a broad sense of what it should be for. It would be in real terms, certainly in the short term, when the public know you don't need to phone up and wait for a couple of days for an appointment, or you don't need to go and queue up somewhere else. You can just turn up to this place. And even though it's, again, intended to be geographically locked into a cohort area in order to pilot, the truth of the matter might well be that folk will see it as an available, travel-toable place and come from all over. We really don't know what we'll get through the door, and we don't know the volume, and we don't know the nature. And it will not be equipped to be an A&E alternative. So it is not like a hospital in which if somebody turns up, and we do say this euphemistically, but you get the point, I'm sure, clutching their chest, then it will not be equipped for that. And that will need to be managed. So there's a whole bunch of different aspects to it that will need to be managed. And that includes if it is in the heart of a community, people coming from all over, people getting frustrated and sitting around for a while, longer than maybe they anticipated, thinking walk-in centre means I'll be seen right away, maybe having some recollections of during and generally post-COVID period of time going in to get their injections, it being quite a quick process. This might not be quite a quick process. People could get frustrated, and therefore we need to protect staff and we need to protect the immediate environment and anybody else potentially affected. Sorry, that was quite long-winded. Apologies for that, but hopefully it gives you a flavour of the considerations.
No, thank you for that. I mean, obviously, we all hope that whatever change there is, it makes the service more accessible and better for the public.
I agree with that.
But I think there are significant concerns about it at the moment, but we'll wait and see how it goes. Just one other question, if I may. It's about the issue of voting rights. Now, as a member of the IJB, I greatly value the input of people with lived experience that come along and give their more personal perspective on the issues. But I'm aware that both for some of those organisations and for the Convention of Scottish Local Authorities, there are significant concerns about extending voting rights to non-elected people. I've already had cause to raise concerns about the lack of elected member representation on the IJB, and therefore the lack of, in my personal opinion as an elected member, the lack of democratic scrutiny. I wonder if you could say a little more about the pros and cons of the voting rights question.
Okay, Gail, do you want to take that one?
Yeah, so I suppose it's important to recognise it's still going through the negative procedure. So there's an assumption that will go through, but there is a chance that it might not, I suppose, just to clarify that. My understanding is there are conversations happening at a national level, in particular between COSLA and Scottish Government, to tease out some of the points that you've made. In terms of the positives and the negatives, I think people with lived experience bring a great deal, and we've appreciated that at the IJB. And I think, from my perspective in terms of in Falkirk, hopefully everybody that participates in the IJB feels that they have the voices listened to and they're supported to do that. There's something for me about how we ensure that if additional people have voting rights, they have the right support sitting behind them, because obviously everybody's aware that the decisions that we have to take just now are really challenging, and they have implications for people, and they're really difficult, and they won't be universally agreed with. So in terms of that support that we have in place, obviously you'll be aware, as a whole, all the members of the IJB, we provide IJB development sessions to really tease through and provide an informal space to work through some of the issues that are being discussed. And obviously all members, including non-voting members, are welcome to that. In addition to that, in terms of the carers representative, for example, we through the carer centre, there's a lot of support put in place to make sure that carers representatives feel supported. We are having discussions with our service user representative about how we can support that role better to make sure that it's connected in with other service users. So I think there's more that can be done in that area in terms of supporting people who come in different roles, especially, and that's important just now, but especially if there is voting rights as well. So obviously there will, my understanding is there's a national group looking at the implementation in terms of how that will work in practice, what the process will be around who is the voting members. My understanding is there's not an assumption that it's the people that are currently the service user and the carers representatives that would necessarily be take those roles. So there might be a process around that. Obviously that work is still ongoing, and there'll be more information I would expect coming out, subject to the SSI being passed. So I think we'll obviously bring it into conversations in the IJB development. I think that the views of those representatives will be absolutely critical in that space, and we'll provide updates to IJB as more information becomes available.
Thank you. Yes, I mean, while I totally agree with you in terms of the value of the lived experience, I have severe concerns about how we can have every type of lived experience on the IJB. The majority of our service users are older people, for example, and we do not have a representative from that perspective. So I look forward to hearing more about it, but I do certainly have some concerns about non-elected people having voting rights.
Okay, thank you. I mean, yeah, we will see the guidance as it comes through. Although it's important to note that those of us who come from an NHS side of the house are not elected members. We are appointed to those roles. Can I bring Councillor Colley in next?
Thank you very much. I echo Councillor Hannah's comments around the individuals and their long-standing awards, and I think recognition of just that commitment that they've had to provide in social care for 25 years is a tremendous commitment, and particularly around the award around the child interview scheme, and I know that the work and the real partnership work in developing that approach was absolutely brilliant. I've got a couple of questions, and they've a couple of them have come from the discussion. So I'll go to them first. And I think the point around voting rights, and I think that I think the general support from members, perhaps with some reservations around that, particularly around that support, and making sure that we are supporting service user and carer representatives to be to have that representative role. And I think, you know, the recognition of the worker care voice and the carer centre and supporting the two carer representatives, I think, has been really important. But I think that general support, certainly for me anyway, but I guess the question was around the integration scheme and the approval process with the Scottish Government. I just want to check that I haven't missed anything. But that point that we were looking around a additional council or an NHS representative, and I suppose one where we are, and will the statutory instrument around voting rights for non-NHS and council members have any implications for the integration scheme?
Gail?
Yeah, so in terms of the integration scheme, just to confirm that the sort of final integration scheme is now with Scottish Government ministers, and hopefully we'll hear back from them shortly. I did speak to the Council's Chief Governance Officer around what implications the SSI might or might not have on the integration scheme. So the advice I was given from him, and again, this might change. So the advice at the moment is that he doesn't think it would require a change to the integration scheme, but it would require a change to the standing orders of the IJB. And colleagues will be aware that we're due to review the standing orders soon. So we'll pick that up at that time. But if we need to do an additional review, we can do that at the time when that's required. So that's my understanding at the moment of what the implications would be from a integration scheme and standing orders perspective.
Okay, thank you. I'll take David and then Amanda.
I've got one other question. Sorry, Chair.
When you go, Fiona.
Yeah, the 2 points around I noticed around the delayed discharge and the care at home, and the inspection and the report that came around from delayed discharge made particular reference around support for carers. And I noted that you were talking about deep dives into both through the performance and audit, and I just wondered about the connections between the two and ensuring those connections are made. And I know that there has been work done with Carer Voice around hospital discharge itself, but I wondered if there was further work, would further work develop as a consequence of particularly the delayed discharge report, but also the care at home inspection.
Okay, Caroline, can I bring you in on that one?
Yeah, so thank you for the question. So in terms of, I take the outcome of the inspection first. So one of the areas that was highlighted for improvement was around our approach to carers. So it wasn't just about our strategic approach, but that delivery approach in terms of ensuring that we're supporting carers at the right time, so they can continue to maintain that role, but also to make sure that we're also providing the right support to the individual, because some of it was about some of the reflections, I think, from carers was around actually if we were able to get more timely support for the adult that I'm supporting, then that would provide, that would sustain me in my caring role. So that's something that we're actively looking at right now. And we've got a plan around refreshing the carer strategy for the partnership. But also it links into some of the reviews, the transformation reviews. So thinking about, our approach to respite, and it links to, the update around the legislation and that, the carer's right to respite. So we want to make sure that our services and resources are in place to support whatever the requirements are around that legislation. If I take the second point that you've highlighted in terms of delayed discharge and our approach to hospital discharge in general, so we work really closely with, there's 2 carer support workers that are part of dedicated to supporting hospital discharge. We're also actively looking at how do we, whatever we're developing around strengthening our approach to hospital discharge, ensures that we're keeping both the supported person and carers at the heart of that process. So actually we had a workshop yesterday around, we're looking at our plans around possibly an integrated discharge service, and we actually had the carers, yourself was there, and David was actually there as well as part of the workshop. And I think, you know, the reflections of people that attended the workshop was really useful, and it actually changed the discussion that we had, and then brought it back down to that kind of person level. So it's just to provide reassurance that we are actively working on these areas. And, you know, I've got a plan around improvement and transformation so we can strengthen our approach, both in terms of carers and hospital discharge.
Okay, thanks, Caroline. David, can I bring you in now?
Yes, thank you, Chair. May I just say that I was really pleased to see Gail's report. I think it was very interesting to see some of the gains and successes we're moving forward. And however, I was really quite disappointed, but I understand fully why we've come out of the care opinion process, or largely out of it. Given that we're a people business, how do we anticipate that we'll get people opinion moving forward if we don't have access to care opinion?
So just to confirm, people can still submit their opinions through care opinion. All that changes are the number of people, members of staff that can access that, and our functionality around that. So everybody, members of the public, can still put their opinions in, and we can still respond to those members of the public. So it was felt it was a more value for money way of doing that. I think Paul's online. I'm wondering if Paul might want to come in and talk more about some of the other mechanisms we have to seek opinions and input from people.
Okay,
Yeah, so
when you go, Paul.
thank you very much, Chair. Yeah, so as Gail said, you can still go online, search for a service on care opinion and submit your story. Though the difference here is that you'll not get a response directly from the service, you'll get a response from a single member of the partnership team. So it's not as personalised, but as she says, more of a value for money way of being able to do that. The other ways that we'll sort of be looking to expand upon, of course, NHS Forth Valley and Falkirk, and each individual organisation does have their own mechanisms for providing feedback. Of course, I think we know that those formal means are often geared towards complaints. So it's gathering that positive story that we know that we need to sort of build and gain opportunities for. Services themselves do receive a lot of direct feedback in terms of, I can tell you that care homes will all have a feedback wall with post-its and letters of thanks and cards, etc. And we are sort of looking at ways of how we gather that and how we share that across the partnership more widely, so we capture those stories, and where there are examples of success, we can build on that and share. So there are definitely other means of capturing that.
Okay, thank you.
Paul. David.
Thank you.
Amanda, thanks for waiting.
Thank you, Chair. It's just to add in that I think starting off being a carer rep, we gather a lot of information for a lot of people that attend the Carers Voice, so we get a very varied look into, you know, different problems in the community. So I think it's not just one person having their voice heard. So I think we feel very lucky to be supported very well with Charlene from the Carer Centre. We went through training with the partnership before we took on the carer rep role to make sure we knew a lot of things about sitting on the IGIB boards. We knew that things couldn't be shared with the public, so that's been upheld with a lot of the reps as well. So we recognise the importance of having reps on boards and things we can share and things we can't share. But in my eyes, a lot of things have been highlighted that they want carers involved in a lot of different services, and I think it's really important that carers are involved. And I think for the amount of work we've been doing with the Carers Voice and being a carer rep, I think it probably is only fair that we get a voting right, because we're putting a lot of work into it. So, and we're very well supported by everybody on the board as well. I have to say that. Thank you.
Thanks, Amanda. That's good to hear. Okay, if there are no other questions, I'll bring us to the recommendations. So consider and comment on the report. We've done that. Can we approve the appointment of Ian Dixon as the third sector rep on both the IGB and the Performance Audit and Assurance Committee? It's agreed. Okay, thank you. Move on then to item 6, which was the to follow paper, the 26-27 business case and medium term financial plan update. Marie.
Thank you, Chair. So just to note, the paper was issued a bit later due to the emerging position around the business case and medium-term financial plan. But for those watching online, the paper is in line with development sessions which have been held with IGB members to discuss and consider the position that's actually set out in the paper. So the report provides an update to the IGB of the latest position in relation to the progress of the 26-7 business case and medium-term financial plan. Members will have had circulated by email this morning an updated Appendix 3, now including the information in relation to Thornton Gardens charges to other authorities. My apologies, this was omitted from the original appendix. The figure for charging for 26-7, should other authorities take up a week in our in-house respite facility, is £2,985.57 per week. As I say, I apologise that was omitted from the original appendix. The last report to IGB in December showed a 5-year budget gap at that point of 14.075 million. A number of changes have been made to assumptions since that time, and those are shown in Table 1 at 4.7 in the report. I will highlight the main changes for members as follows. The underlying pressures for this financial year have now been included along with mitigating actions expected during the next financial year. Mainly care at home additional pressure of 1.9 million and in-house residential care of 1.2 million. Some of the mitigating actions relate to the continuation of our review team with a targeted reduction of 600,000 included, and the intention to divert 800,000 of our long-term care budget to the care and support at home budget, supported by the resource allocation processes we have in place to manage down the number of long-term care placements we have. This is supported by the continued discharge to assess work through the Shift in the Balance of Care project. I have also assumed that some use of recurring development funds will be required during 26-7 to offset some of these pressures. Our joint loan equipment store is subject to a review at present, and early indications are that additional budget is required for our equipment spend, which overspends each year. Therefore, an indicative pressure of 100,000 is now included. An adjustment has been made to prescribe inefficiencies based on the latest indicative initiatives for next financial year. And provision has now been made within the plan for the next 5 years for transition cases, which will move from children's to adult care. This is based on current packages in place, and work is ongoing to identify and manage transitions. An estimate has now been included as a marker for any pressure arising from agenda for change reduced working week and any further band 5 to 6 regradings. Work is ongoing to finalise this figure, but I thought it important to flag the pressure and include an initial estimate at this time. The Primary Care Improvement Programme has been shown as a risk throughout the budget process. The latest projections for this and next financial year have given an indication that it would be reasonable to assume an overcommitment of approximately 600,000 next financial year. Therefore, I have included a 300,000 pressure in the meantime for Falkirk's share of this pressure, and have had discussions with Claxton Stirling CFO around their element of that as well. Work will need to continue in this area to ensure best value use of the funds available. It is important to note that the current assumptions address underlying pressures currently projected, but give no additionality for next financial year, although there is an allowance built in for future years. Mitigating actions include resource allocation panel limits. We'll need to continue to keep spend within budgets for next financial year, and the transformation programme will be challenging. Funding for 2% non-pay uplift for next financial year was included in the December update. Discussions with the CFO for NHS Forth Valley have indicated that it is reasonable to assume this uplift for future years of the plan, and this has now been included, giving an additional income to offset pressures of 2.268 million. Finally, in the table, I have given an indication of the current level of proposals which will be brought forward for approval to the March meeting around efficiencies and transformation. Firstly, for social care charging, which are shown in the updated Appendix 3, which has been issued, giving a 5-year uplift of 1.8 million, and further proposals totalling 2.4 million at this point. These have been the subject of the IJB development sessions mentioned and will be finalised in the coming weeks prior to being brought to the March meeting. Our social care charging proposals are subject to consultation at the moment, and the findings will be included in an EPIA to Council, as they are required to approve the charges, as this function is not delegated to the IJB. All of those affected are receiving letters to invite them to take part in the consultation process. The adjustments set out bring the final gap over the 5-year period to 14.075 million. The gap for next financial year is 2.742 million at this point, and meetings with partner organisations continue to identify any potential solutions or risk share arrangements which may be required. These discussions continue to be supportive and helpful in our planning process, and partner bodies are still understanding the overall financial settlement and working towards agreeing the overall funding package to the IJB for next year. A further development session is planned in February with members to inform members of the latest position prior to the March meeting. The children and families position is also noted in Appendix 1 and will be included in the March paper, assuming the integration scheme is approved by Scottish Government, and Gail's already mentioned that that's been submitted for approval. Justice services will also be included and is expected to manage within the existing grant and core budget. The information for prison healthcare was not available at the time of issue in this report, but the assumption is that this will continue to be funded on a non-recurring basis each financial year. The position set out also assumes that funding in relation to shifting the balance of care will be made recurring, pending the presentation of the business case to NHS Forth Valley. Gail has also mentioned additional slippage money, and at this point, that slippage is non-recurring funding. So during next financial year, packages will require to be managed down, coming to the end of the 12-month period which are funded. So it's important to note that that will bring those packages down again. Appendix 4 has now been added, giving some sensitivity analysis for scenarios, including additional pay uplifts, demographic pressures, inflationary agreements and pressures, and additional transition pressures. Prisons will be added once the information has been received and included in the March business case appendices. Appendix 5 sets out the funding allocations to our third and independent sector partners within the current partnership funds budgets. These recommendations follow a process of review by the same group involved in previous year's process, taking into account overall budgets and the monitoring information received from organisations to date for this financial year, setting out outcomes and progress. A package of 3.229 million is proposed within the existing budget, and members are being asked to approve these today to allow notification to providers as appropriate. Risks are set out in Section 5 and remain similar as previously reported. The plan will be brought in March. The plan which will be brought in March will not provide a balanced position for the medium term. Our management team and finance oversight group will continue to develop transformation proposals in the coming months alongside the development of our new strategic plan, and regular updates will be brought to members through development sessions and future boards. The financial position of IJBs is extremely challenging, without funding for additionality, and it will require continual identification of efficiency and transformation. Recommendations are shown at Section 2, including to note the approach set out and agreed by our senior leadership team for our care at home redesign, which is set out in paragraphs 4.24 to 4.27. I'm happy to take any questions. Thanks, Chair.
Thanks, Marie. Yeah, not a great position overall, but a clear position, or as clear as it can be based on the information we have right now. So thank you for that. I'll open it up for questions and comment. Councillor Hannah.
Thank you, Convener. I recognise that the timing of the UK budget and the timing of the Scottish budget have been challenging for finance officers in terms of bringing this forward. But I do have to say I haven't really had the time to study this as that I would have liked. Having been at the development sessions, I had some idea of what was coming forward. But I do think it's important to just say that none of the board members will have had a great deal of time to study this. However, what I was wanting to ask about is in terms of the budget. Again, the Convention of Scottish Local Authorities has described the Scottish budget as a very poor settlement and has made particular reference to the lack of funding in that settlement for social care. I wonder if you're able to say, I know it's early days yet, but if you're able to say a little more about what the funding, the addition, if there is any. Indeed, the Convention of Scottish Local Authorities is suggesting that there isn't really any additionality in terms of social care funding in the budget. And I wonder if you're able to give any more detailed information on that for the Falkirk IJB.
So I suppose Councillor Hannah, yeah, I accept that paper came out late, but it absolutely is in line with the development sessions that we've had. And I suppose it was just about making sure that it was as up to date as it possibly could be when it was issued. Around the COSLA paper, yeah, absolutely. So the funding that's included in my assumptions at the moment is in relation to the Scottish Living Wage uplift and the free personal nursing care uplift. So the funding for Scottish Living Wage does not cover our liability around that at the moment. So there's a 1.4 million shortfall. So our liability is just over 6 million, and the funding that we are getting is 1.4 million short of that. So it's just to say, although that Scottish Living Wage funding is allocated, a number, it's allocated on a percentage uplift basis across councils. Some areas will have higher in-house service or higher external provision. We have quite a high external provision here, so that liability is a bit higher for us of passing on that Scottish Living Wage. So that is not sufficient funding. Free personal nursing care funding that we receive comes in the door and goes straight back out, so the liability is the same as the funding. At this point in time, there is no additionality agreed. Through the Scottish Government settlement, there is additional funding there, which has been allocated across councils in relation to the GAE settlement, and part of that was around a redistribution of social care funding. So the council CFO is absolutely working with members around bringing forward a paper to council for agreement. So at this point in time, we don't know what the final outcome of that will be. We are having really positive discussions with the council and NHS Forth Valley, and supportive discussions around our position and around potential risk share arrangements for next year already. But at this point in time, I don't know what that final settlement's going to look like, unfortunately.
So can I just clarify there that in terms of the settlement, as you know it at the moment, it's 1.4 million short of just covering things that have already been agreed?
Yeah, so absolutely, yes, and it provides no additionality. There is no additionality approved. So the budget that we've built up at the moment addresses the pressures we have this year with a number of mitigating actions, which will be really challenging. So the 1.4 million approximately equates to that shortfall for Scottish Living Wage. But just to reiterate, there is no additionality built in for additional packages for next financial year at this point.
Okay, thank you. I just wanted to be absolutely clear about that. It is obviously very worrying that is the case, particularly given the fact that we know the demand for the service is going to be increasing as time goes on. However, I'd like to just move on to the question of consultation, and I welcome the fact that there has been a lot of information put out to individuals. I know because I had real trouble getting to the getting to the printer rather in the other day, because there were thousands of letters being printed off to be sent out to service users, and I couldn't get my paperwork printed. But I recognise the importance of that consultation. So well done to those who've been involved in doing that. And I think it is important that we consult as widely as possible on the implications of the budgetary position. I did, however, notice, and I have to say this as an elected member for the Lower Braes, that in terms of the face-to-face sessions, there are none in the Braes, neither Lower nor Upper Braes. There are sessions in a number of the libraries in other areas. So I wondered if it's possible for further sessions to be set up for consultation with service users and their carers.
So I'm happy to speak to our engagement staff and see if we can maybe set up a session in the next couple of weeks, so I can pick that up after the meeting. So I suppose just to say as well, I attended the Carers Voices group on Monday to go through the proposals. Those letters that you mentioned, I apologise you weren't able to get to the printer. So those letters have gone out to everybody who may be affected by those charging proposals. So everybody should receive a letter encouraging them to take part in that process. As you mentioned, we've got a number of sessions at libraries and at housing and care units as well as inviting people to phone in if they want a paper copy of the consultation or any advice around that. But I'm happy to take that away and speak to our engagement staff and see if we can get a session set up in the Brave.
No, I compliment yourself and all the staff who've been involved in designing the consultation, and it is a wider consultation than we've ever seen before. So sorry to be asking for extra.
Okay, thank you. Councillor Colley, can I bring you in?
Yes, and thank you for the report. Obviously, with the members of the IJB, been having quite a lot of conversation, so that this feels relatively familiar. I suppose just a couple of questions, and they're I suppose relative. One is an area I've got a little bit of concern about what the scale of the risk is in 5.9 around job evaluations, and without obviously the process around submitting job evaluations, etc., is all confidential. So I'm not asking around the roles themselves, but it's around the scale and what the potential scale of that risk is. So a question on that, and one was quite specific. It was around on page 22 of the Appendix 5, around dementia services, and there was a to be confirmed, and I just wondered if there was more information on why that was still to be confirmed. That was all.
Thanks for your questions, Councillor Colley. Yeah, around job evaluations, so the outcome of those are not finalised at this point. We have got indicative figures around what that may be. So I suppose it depends on the element of backdating, if any of that were agreed. So I wouldn't want to talk about figures today. We have indicative amounts, but until we know what that agreement is and what the backdating element is, it can range. I suppose I could give you a range. It can range from 140,000 to over £1 million potentially, but it depends on what that job evaluation process outcome is. So I wouldn't like to speculate on what the final outcome would be at this point. On Appendix 5, the to be confirmed figure for 8-pillar dementia support, the group who took through the funding proposals, there was an amount set aside for that support, and nobody's providing that at the moment. So we felt it important to keep money set aside and develop proposals around providing that 8-pillar dementia support. So nobody's providing that right now, but that money's set aside to take forward proposals for that for next financial year. Thanks.
Okay, are there any other questions or comments? David.
So, Chair, may I just seeking further information from Councillor Colley's just comments about job valuations. I'm a bit naive here in terms. Is this an upgrading of staff? And if so, what are the additional services that service users will be accessing as a consequence of the increased skill sets?
So this relates to claims from a number of staff that they feel their job hasn't, the amount they're paid for the job doesn't reflect the duties that they're doing. That's their view. So they've asked for their jobs to be reevaluated to check that the evaluation is appropriate and up to date. So that process, there's a number of different job types that employees have come forward, and all employees have the right to ask for that through the council or through the NHS. So that process is ongoing. There is no yet conclusion. So, and the discussion around how the process will be taken forward is still ongoing as well. So it's quite early days. But if a member of staff feels actually their job that they do on a day-to-day basis doesn't reflect their job description and therefore doesn't reflect the pay that they get received, they have the right to ask for that to be considered, and that's the position that we're in for across a number of different jobs in the council side at the moment.
Thank you very much. Thank you.
If there are no further questions, then I'll take us through the recommendations. There are some important ones here, so I want to take them one by one just so we're clear about the decisions we're taking. So firstly, can we note the funding pressures and risks identified and the actions taken as per section 5 of the report? Okay. 2.2 then, can we approve the recommended payments for partnership funds to third and independent sector providers as per item 5 of the report?
Agreed.
Thank you. 2.3 then is to endorse the charging proposals set out in the amended Appendix 3 for remitting to Falkirk Council as they have the decision-making authority in this. Can we agree to pass that on to Council?
Agreed.
Okay, and recommendation 4 then is to note the approach for the care at home redesign and bedded care reviews as set out in paragraphs 4.24 to 4.27 of the report. We agree that. Okay, thank you so much. Back to the main agenda pack then, and item 7, which is the budget monitoring report for January. Marie.
Thanks, Chair. So this report provides the high-level summary of the current 25-26 projected financial position, including consideration of the risks to that position. It should be noted that projections are based on forecasts using month 8, which is up to November 2025, with the information available from the respective finance teams. There is a current projected overspend of 6.8 million, which is a 357,000 adverse movement since previously reported on the integrated budgets, and an overspend of 5.854 in relation to set aside budgets for large hospital services. Services in relation to social care are expected to overspend by 8.447 million, and integrated services provided by NHS Forth Valley are currently expected to underspend by 1.6 million. For the purposes of this report, the overall projected position will be manageable with the use of risk share contributions agreed from partners and the use of IJB contingency reserves held. The Appendix 5 sets out the current detailed IJB reserves position. Earmarked reserves of 13.3 million and contingency reserves of 2.3 million were held as at 1st of April 2025. There are commitments of 10.4 million against earmarked reserves, with an expected remaining usable reserve balance of 1.3 million at this point, after addressing the year-end overspend. Based on current projected spend, it is anticipated that the 2.239 million will require to be drawn from the contingency reserves. Services provided by Falkirk Council for social care have a projected overspend of 8.447 million, and the main reasons for the variances are set out from 4.11 onwards. I'll highlight the main areas. So care and support at home services have a projected overspend of 2.8 million. An overspend of 6.9 is currently anticipated in relation to external care, which is offset by an expected underspend on in-house care at home services of just over 4 million in relation to the number of vacancies held pending the care at home redesign. In-house residential care is showing a forecast overspend of 1.159 million for the year. Control of agency spend as much as possible is continuing across the HSCP where possible. This service will also be subject to the review as part of the bedded care review, agreed as part of the medium-term financial plan, with the requirement to reduce the overspend and meet the overall efficiency set. External residential care is currently projecting an overspend of just over £1 million. The Residential Resource Allocation Panel is currently managing down the number of placements over the coming months to reflect the shifting the balance of care project and continued discharge to assess work, and to bring down projected spend in this area, to facilitate reduced spend and transfer of budget to care at home moving forward. Previous actions to date have not significantly impacted the long-term care waiting list. Daycare services are projected to underspend at this stage by 261,000, mainly in relation to vacancies held, offset by some spend in external daycare provision. Development funds, a number of development funds recurringly are held for allocated funding for specific initiatives. An in-year underspend of 433,000 is currently anticipated for these budget lines, which is helping to offset some areas of overspend. Services in relation to the NHS side of our budget are projected to underspend by 1.6 million. This is split between community healthcare, which shows an underspend of 2.9 million, and primary care, which is currently projecting an overspend of 1.271 million. Within community healthcare, budgets in relation to community hospitals are currently projected to underspend by 262,000, and the majority of the remaining underspend is in relation to staffing throughout services, which includes the updated overall vacancy management target of 1.6 million. The underspends in community healthcare are offset by a projected overspend of 245,000 in relation to complex care cases within learning disability services for adults. Primary care has a projected overspend of 1.271 million, and this is mainly in relation to the budget for prescribing. The forecast is based on the latest analysis of cost and volumes, and total budget pressures of 5.9 million were added in the 25-26 business case to address one-off contributions from last year, and an additional 7.5% was included to address cost and volume pressures. There are a number of initiatives ongoing around prescribing to bring forward savings as the year progresses. The 25-6 business case included 11.4 million of agreed efficiency and transformation proposals. Within this total, 5.892 million of proposals related to budget adjustments, which have been achieved. Appendix 4 shows each of the proposals still to be implemented and gives details of whether they are now been applied to budgets and updates on projected achievements at this stage. It is currently anticipated that 1.3 million of agreed efficiencies will not be achievable this financial year, as set out in Appendix 4. Delivery of the transformation proposal still remains a risk to the in-year financial position, but anticipated underachievements at this stage are included in that overall projected position. The IJB's contingency reserves, risks are set out from 4.23 onwards, and I'll highlight some. The IJB's contingency reserves are now held at the recommended level. The overall projected overspend poses a risk to the ongoing requirement to hold these reserves, and in turn the IJB's ability to address ongoing demands and emerging operational challenges. Demand for care and support at home continues to be a challenge. A number of roles, as we've already mentioned today, have been submitted for job evaluation, and this remains a risk to the position as well. The volatility of prescribing costs and the demands for new medicines continue to pose a risk to this year and future financial positions. And primary care improvement plan, although is noted at 4.29, the latest position, which I've now reflected in the budget pressures, is that we have that overcommitment for next year, and I've now made provision within the overall business case around that position, and for this financial year it is expected to be met within existing resources. The risk score for strategic risk 1, financial sustainability, remains very high, and financial sustainability is a feature of both internal and external audit actions. I'm happy to take any questions, and the recommendations are set out at section 2. Thank you.
Okay, thanks, Marie. Very, very clear as always, given the complexity of the position. Not a good position overall, but at least we know where we are. Are there questions or comments from members? Councillor Hannah.
Yes, thank you for this report, depressing though it may be. There's significant overspends, obviously. Can you yet give a figure? I know we're not yet at the end of the financial year, but can you give a figure of what is going to be the ask because of Falkirk Council? Because that is clearly a matter, I think, and is there a further ask of the NHS to try to balance this budget at the end of this financial year?
Yes, so the table at 4.2 shows that there are current recognised risk shares by the partners of 4.5 million. So I am assuming that we will receive these risk shares. I've set that out in discussions with partners. So the council is currently assuming a 2.592 million contribution to the IJB, and NHS Forth Valley have passed over 1.9 million already, which is sitting within our reserves position. So I'm currently assuming that we'll be using the full amount of these risk share arrangements.
But you're not anticipating it being higher than these?
Not at this stage.
Figures.
So those discussions are around passing over that current risk share, and we would be utilising our remaining contingency reserves for the remaining balance. So the table at 4.2 shows that that would be 2.239 million coming out of our contingency reserves at the year end at the moment. Obviously, that may change. That position may change as we come to the year end.
Okay, thank you. On a more slightly more specific point, in 4.8, there's reference to the shifting the balance of care and the expectation that all the funds available for that will be used. Given the clear advantages that there are in terms of the costs by getting people out of hospital more quickly, but also given the fact that the IJB will require funds to enable the care at home to be funded, to make that possible, is there a danger that the extension of this project and broadening it out to try and get more people out of hospital, is that at risk?
So we're actually in the process of finalising the business case to be presented to NHS Forth Valley at this point in time. So, notwithstanding, I can't preempt the outcome of that. But the discussions we are having at the moment are on the basis that NHS Forth Valley are assuming that that's going to happen at this point in time. But obviously, that's subject to approval by the NHS Forth Valley board.
Thank you. It's one of the most exciting projects that we are actually undertaking in health and social care at the moment, and it has the potential to reduce costs in the long run, and we must continue it. Thank you.
Yeah, and as Marie said, it will come to NHS board next month for approval. But certainly my personal view is that I agree entirely with you. This is exactly what health and social care integration is supposed to be about. Okay, any other comments or questions, colleagues? No, I'm not seeing anything, so I'll take us to the recommendation then. So we're asked to note the projected position for integrated budgets and set-aside services. We're asked to note the recurring reserves position as per Appendix 5, and we're asked to authorise the Chief Officer to issue revised directions as per Appendix 6. Are those recommendations agreed? Okay, thank you. We've been going about an hour or so. Would people like a short break at this point? Yeah, shall we take maybe 10 minutes, come back about 10:50? Is that okay? Thank you, everyone. Thank you, folks. Can we get started again? We are back live streaming. Okay, we're on to agenda item 8, which is the Chief Social Work Officer Annual Report. Sarah.
Thank you, Chair. The Chief Social Work Officer Annual Report provides professional assurance to the Integration Joint Board on the delivery of statutory social work functions across Falkirk during the reporting period, which is 2024 to 2025. It sets out how social work services have met their responsibilities in relation to governance, quality and performance, and reflects our shared commitment as an integrated partnership to protecting and supporting people across the life course from pre-birth through to end of life, whilst promoting our values of dignity, safety, human rights and independence. I'd like to begin by acknowledging our workforce. Social work and social care staff have continued to demonstrate exceptional professionalism, resilience and compassion in what has been another challenging year. Despite sustained demand, increased complexity and ongoing workforce pressures, staff have continued to deliver high quality, person-centred services. Their contribution is central to the effectiveness and credibility of our integrated system, and this report formally recognises the vital role that they play. Over the course of the year, we've made significant progress in strengthening integration, professional leadership and practice quality. A major milestone has been the integration of Children's and Justice Social Work Services into the Health and Social Care Partnership from April 2025. This represents an important step in strengthening our whole system approach to care, support and protection, and in aligning governance, accountability and improvement activity across the partnership. We've continued to invest in workforce development with the introduction of new career pathways, expanded multi-agency training, simulation-based learning, and increased student placement opportunities. Advanced practitioner roles are now embedded across services, supporting practice quality, professional supervision and leadership capacity. This has been underpinned by continued focus on trauma-informed practice and anti-racist approaches. We've strengthened decision-making and assurance arrangements. Resource allocation panels are now in place, improving consistency, transparency and equity in care planning and resource use. Alongside this, revised management and leadership structures have enhanced professional oversight, quality assurance and accountability. Within Justice Services, progress has continued with the development of a new through care team aimed at improving outcomes for people leaving custody. The Women's Justice Service continues to provide trauma-informed, gender-specific support aligned with national policy direction and best practice. Public protection remains a key area of focus. During that reporting year, we strengthened multi-agency adult support and protection arrangements, we refreshed protocols, delivered targeted learning on financial harm, and supported a series of Chief Officer webinars to promote shared learning and system leadership. The report is clear, however, that challenges remain. Recruitment and retention pressures persist, particularly in relation to experienced social workers, mental health officers, and occupational therapists. We continue to manage increasing demand and complexity across services. Alongside ongoing financial pressures, these risks are well understood and are actively being managed through partnership governance, workforce planning, and continuous improvement arrangements. Looking ahead to 25-26 and in line with the Scottish Government's reporting framework, the report identifies key priorities. These include consolidating and embedding the integration of Children's and Justice Social Work Services, delivering Falkirk's trauma-informed strategy and action plan, progressing our commitment to the promise for care experienced babies, children and young people, including strengthening foster care recruitment and support, and continuing to invest in workforce development, leadership capacity and staff wellbeing. In closing, Chair, I want to thank colleagues across all services who have contributed to this report, and more importantly for the continued commitment to delivering safe, effective and compassionate social work services. I invite the IGB to note the progress made, the challenges identified and the priorities for the year ahead. The annual report was presented to Falkirk Council at its December meeting and was consequently issued to Scottish Government in line with that requirement. Colleagues are present with me today and together we're happy to take any questions. Thank you.
Thanks, Sarah. It's a good report and there is some excellent work in there, some real progress across a whole number of areas. So thank you for highlighting that. Do members have questions or comments? Councillor Hannah.
Thank you, convener. Yes, thank you, Sarah, for your excellent, as always, excellent report. And it is a testament to the commitment of the staff involved that there's so many good things to talk about in this. However, I do have a number of questions I'd like to ask. First of all, could you say a little more about recruitment and retention? I think that has in the past been an issue of concern for the team.
Thank you, Councillor Hannah. And you're absolutely right. This has been a theme of the annual report in terms of the outlining of pressures for a number of years, and I don't anticipate it not featuring in the next few reports. The recruitment and retention of social workers and occupational therapists is a pressure not only locally but nationally. We have a recruitment and retention working group which meets on a regular basis. It's become routine and has been in place now for perhaps 3 years, perhaps even a little longer. And actually yesterday there was a recruitment and retention focused workshop that took place, and Martin was there, Roger was there, so there was a number of people, really good attendance, and I suppose it's a huge commitment to try and work together to do everything we can to resolve the pressures that come from challenges around recruitment and retention. It continues to be a strain. We can't take our eye off of different ways and more creative ways of ensuring that Falkirk is a place of choice for people to come to work. We do everything we can to have numbers of student placements ongoing at any point in time. We have Grow Our Own initiatives. We have been successful in keeping social work students with us or them returning to us when their courses have concluded. We introduced advanced practitioner and assistant team manager roles a couple of years ago, and that was about developing much clearer progression routes to improve retention, and they have proved successful for us. We've developed a number of different career pathways, and we have a particular post in place to make sure that we are doing everything we can to support our newly qualified social workers, because we know that research has shown us that people are leaving the profession very quickly from the point that they are becoming a registered social worker, and they're leaving within the first few years. So we are looking to turn that curve for us here to make that as positive an experience as possible. We're needing to respond as much as we can to a changing way that people are choosing to work. So we need to be responsive to what we understand about how workforce requirements have changed, and that people might not want to just be a social worker for all of their life. I would recommend that people do consider doing it for all of their working life. I think there's a lot of different ways that you can embrace all the different facets that social work profession can offer to you, but we know that people are now choosing to perhaps go into teaching at a different stage of their life, or they want to move from working in adult social work services to children and families to justice, and we're being asked to really think about how we can make that a meaningful offer. And I think some of that would have been covered at yesterday's workshop. I expect that would have been the case. So targeted recruitment around those really hard to fill roles around mental health officers and occupational therapists. We were having a conversation earlier about the potential for us to refresh some of our videos about attracting people to come and work in Falkirk. They were a positive development we had, but the videos are probably a little tired now and we should refresh. And again, we were really supported by our workforce, who also chose to be part of those videos, and we had embedded them in adverts so that people could see what we had on offer, what the recruitment pathway looked like to be able to advance your career in Falkirk. And we had some really positive feedback there. So we need to understand why people do choose to leave. We need to understand through exit interviews what is a reason for people to be leaving. There's lots of different reasons, obviously, and we obviously importantly want to understand what is it that actually keeps people here. And you commented earlier, Councillor Hannah, about hearing from people yesterday how much they love their job, and we want people to really enjoy their job, and it is very possible to love your job here. So what is it that actually keeps people with us? I don't know whether, Martin, you want to add anything about the workshop yesterday, or if you feel I've covered most of it.
It's really, I think you've covered most of the points. I mean, the workshop session did look really and focus on why do people leave the profession. I think some of the national studies suggest that people leave social work particularly probably after about 5 years, which is actually a really short period of time when you think around the fact it probably takes you 4 years to train to be a social worker. So we are really beginning to look at actually why is it that we lose people from the profession. And as Sarah said, part of that's around looking at exit interviews. And a big part of the discussion that came up yesterday was how can we broaden people's opportunities so that they can get that chance to move around the system rather than stay in one part of the service. And it was exactly that. There's absolutely no reason someone shouldn't be able to move from justice services into adult social work or children family social work or vice versa. And I guess the view from people yesterday was pretty much that actually if we offer those opportunities, it will keep people interested and engaged, and hopefully address that issue around burnout. But the session lasted about, I think it was 3 hours yesterday, and there was an awful lot of discussion. So we're pulling the feedback from that together, and we'll incorporate that into the future thinking around the model. Roger was at the meeting yesterday. I'm sure he'll have a different view coming from a different perspective, but thanks.
Thanks, Martin. Did you want to come in on this point, Roger? Yeah, and you go.
Thanks. Just to say that it was a really good session yesterday. It was a bit of time coming, unfortunately, because it took a bit of organising. And back to join in with previous discussions, the person leading it, Evelyn, it will be 40 years for Falkirk Council this year. So it does show that if with the right things in place, people will stay with Falkirk Council long term. And I think it doesn't, the discussions yesterday show that it doesn't necessarily take huge changes to keep people retained in the council. The proof will be in the pudding, but I was very positive about yesterday.
Okay, thank you for that. Councillor Hannah.
Thank you very much for that. That takes me kind of on to my second question. I wonder if you could say a little more about early intervention and prevention, because clearly that is one of the biggest challenges, and working in this area is challenging, but can be very, very valuable, particularly and very enjoyable, as you said earlier, particularly if you can actually get into that preventative corner of the work.
Thank you. So in social work, and we always think about early intervention, and it can mean lots of different things. So early intervention and prevention can be the work that you do well in advance of a family requiring support. So considering that within a children and family setting, it would be about embracing all that comes with GIRFEC and making sure that there is the appropriate support, the right people at the right time, and if there's escalation to social work, that doesn't mean that things have gone wrong or that they haven't worked. It's just that that's the right service at that right point in time for a family. Early intervention can be getting involved with a family at just the right point in time for them to stop their particular needs escalating to the point where a child would need to be placed out with their own home, or getting involved when a baby has entered a family and additional supports are required. In terms of some important work that we've been bringing forward as a consequence of the promise, which is our commitment to care experienced children, babies and young people, and as a national promise that we have obviously embraced locally. We've been supported by funding, short-term funding, but some significant funding through the Whole Family Wellbeing Fund. We've utilised that money to allow us to take forward a number of different tests of change. And the criteria is quite clear that that has got to be very much focused in terms of what we know our gaps are, about embracing the whole family perspective, and about taking forward initiatives that are exactly as you're describing. It's about as preventative as possible to be able to create different experiences for a range of different requirements and needs. So we've got 18 tests of change that have been supported by the Whole Family Wellbeing Fund. They have come forward from a variety of different groups, special interest groups. They are very much informed by what we know are gaps that we've understood from our data, and also come forward from views and perspectives from community-based groups, service user groups, young people, champs, etc. One of the initiatives there is a cash first approach that we have in our locality teams, which is about being really directive, that if a family comes to us through the initial response team, which is our front door of children and family social work, we're able to be really responsive and being able to put a plan in place that can make a really significant difference for a family. It can shorten the time of intervention, and it is, and that's been a year that we've had that in place. Part of the Promise implementation team, who are in charge and responsible for utilising the funding through WWF, is tracking the performance of the different pilots that we've got ongoing, tweaking them as we go, but ultimately it is about ensuring that the success of them, we have been able to track the progress of that, and they are reporting back through the Children's Partnership Leadership Group. That's where the governance is of that funding. So it's just some examples of early intervention and prevention.
Excellent. Thank you very much for that. Just one last question. Could you say a little more about the Bairnshuis and how that's developing and what the prospects are of having a Forth Valley Bairnshuis?
So I will be as ambitious to say that we will have a Forth Valley Bairnshuis. There is a strategic Bairnshuis group which meets frequently, and it reports into the Falkirk Public Protection Chief Officers Group. So we are kept updated and appraised of the developments via that group. Bairnshuis is a national policy intention, and there are some sites across Scotland that we are learning from. I was recently with the Forth Valley Child Interview team, who were recognised yesterday at the awards ceremony, and they currently operate out of a number of different venues across the Forth Valley area to support the interviewing of children to gain best evidence for court proceedings in areas, venues, that are considered to be trauma-informed and as therapeutic as possible for children. Bairnshuis really is about ensuring that we have a suitable space, place, that's our Bairnshuis, that will be primarily utilised to be able to support children for those interviews. So it's a one space place that can provide a number of different services around a child. It will be a discrete setting, and where it will be is yet to be decided, but the team were telling me this week that there's been some progress made in terms of consideration of where that actually could be. So it's work progressing. It can't just be any old building. It has to be very carefully thought through. But I'm happy to keep you abreast of developments, because it seems that there have been some significant ones.
Yeah, thank you for that. I'm also pleased to see that there's extensive consultation with young people to get their views on it as well. So thank you very much for that.
Brilliant, thank you. Stephen?
Thanks, Chair, and thanks for the tutorial on how to use the system there. Thank you. First time I've used it. I suppose 2 points. Thanks, Sarah, for that. This is the third Chief Officer Social Works report I've read this week, and I know it's a template. They're all remarkably similar, and fantastic work going on across the whole of Forth Valley. I suppose my first point is a follow-up from Councillor Hannah's point about retention, particularly in the mental health field, and I'm wondering if we know there's a national issue around about this, and it doesn't seem to matter what we do, we can't, get sufficient resource in there. And we're all competing against one another. I'm wondering if there's a bit of a pan Forth Valley look at this, that we can maximise the resource across the whole of the area that would maybe help there. My second point is in relation to the child protection referrals. I mean, remarkable amount of work done there in the last year, which is fantastic when you see the numbers on the register reducing. However, again, we're seeing nationally a bit of an increase, and that's shown just in your graph. It's slightly going up again in terms of the number. In fact, we're parity in February of this year, the numbers that are going onto the register and the numbers that are coming off. And I'm wondering if we can say anything round about that, what's happening in that space, because we don't want to be back to where we were last year, where we had, in fact, May, where we had just short of 90, because we've got the numbers down. What's your views on that? Thank you.
For the question. So in terms of child protection registration numbers, they are very, very difficult to propose whether having high numbers or low numbers is a good thing or a bad thing. For us, it's about understanding our numbers, and it is about ensuring that we have really suitable arrangements around the governance of our child protection data. And I can give assurance that we do. The oversight of that is within the Child Protection Committee, where we have data reporting as a standing item. We have a minimum data set, which is a national data set that we respond to. There is always time dedicated on agenda to ensure that committee members, so multi-agency committee, are really focused on the data that we have in front of us. We also have prompt questions, and obviously it's open to committee to ask any questions that they want around our data. The Child Protection Committee is supported by an improvement group, so that's a subgroup that reports into committee. They spend even longer with the data. They work on all of the audit work that is requested from CPC. So where we want to know much more about our child protection registrations, for example, the work is typically done by the subgroup. Over the CPC, we have the Falkirk Child Protection, we have the Falkirk COG, which is the Chief Officers Group for Public Protection. The data sets from Adult Protection Committee and Child Protection Committee are routinely reported also into COG. So there are questions there from chief officers, again, multi-agency basis, and they've often been curious about exactly your question. Is the volatility really in terms of we've had high numbers, so we have been outliers in terms of national comparator data. So it's about the question, I think. So your question, it's the question, and it's us understanding what it is telling us. And it's never telling us one thing, and I suppose that for me is the good thing. There's not one particular reason why our numbers can be volatile. They are currently lower this week. They could be higher again next week. We're curious about children being re-registered. Why would a child come off of the name come off of the child protection register and then go back on a few months later? That's a question in itself we need to understand. We can have large sibling groups that can throw the data as well, so that could increase the data and also decrease the data. So we are largely now in line with the national comparator. As you say, that moves around itself. So the assurance that I would give you would, I think, be the fact that we work really hard to understand what it's telling us. We look at that in detail, and also we will use that to target where we might have service gaps, for example. So, and to work really closely with our partners to understand, for example, if there was an issue around child sexual abuse and exploitation, if we were seeing that, for example, in our data, it would be a targeted approach, and we would be pulling on our frameworks or looking at what we need to update or consider what we need to feed in nationally. So we are always very curious about it, very responsive, and trying not to ever be reactive, because we do have an understanding of how movable it is. I hope that helps answer the question.
Okay, I'll take David next.
Thank you, Chair. It's a question for Zara. A very thorough report, and thank you very much for that. My question relates to the reduction in recurring budgets and the impact that might have on our third sector colleagues, who you rely on very heavily, as it states in the report. What impact on service users will occur as a consequence of the reduction in recurring budgets?
Thank you. Obviously, there is a real challenge on us in terms of managing reduction in budget. The Equality Poverty Impact Assessment process is helpful, particularly when we embrace the principles of that and start that very early when there is any proposal about reduction in funding, and that is a requirement of us around any policy change or a budget change. It can really help focus us working together with any impacted group, whether that be an organisation or whether that be our users of a service, the people that are relying on the service that's being delivered as it currently stands, and working well together to consider what we can do, again, together to mitigate impact, to find different ways of providing services, and to support people to understand how they can receive services in various different ways. So that is a really key assessment. It's not just a static tick box exercise. It really does support us. It includes consultation, so there is an characteristic groups and within organisations that we support. So it is part of the process. And I myself have had good experiences of working alongside organisations when we have perhaps disinvested in an area, reinvested in other areas, and worked closely with those organisations so that we continue to have relationships out with the challenge of that work. It's about doing together these difficult things and finding different ways and creative ways of meeting the needs of the people in our communities, which are really changeable. They're really changeable, so we need to be able to be really responsive and do things differently, not just continue to do things the same way all of the time. We know that doesn't work. Hopefully that's a helpful answer to your question. Thank you.
Okay, can I ask a supplementary, Chair? Really, just did I assume from that there will be no alteration downward in the service delivery given by the third sector as a consequence of the budget reduction?
No, I didn't mean to give that expectation in my response. I think what I was trying to explain was that, yes, there is impact, and we work together to mitigate impact of that impact.
Okay, thank you very much. Thank you.
Okay, thanks. Amanda?
Yeah. Thank you for that. And it was good to see that carers are mentioned in the report and the impact that it can have on them as well. carers have highlighted that they're still finding it difficult to access social care, which I think has been highlighted to you before, but it's still a recurring thing that's coming through from carers. Also, with carers involved in kinship caring, they're finding it quite hard and problematic that they're not being involved in decisions that are being made around a table. They feel like when problems arise, that people are not getting back to them. So this is causing a lot of stress on carers, and then therefore their health is really suffering through it. So that's been highlighted a few times from carers that we've seen with kinship. They feel as though they're not included, whereas they're very important in that kinship care. Because I know there's the thing about closer to home, which is so important for kids. But I think if the kinship carer feels as though they're not included, then that's quite distressing for them. Thanks.
So thank you for raising that and making me aware of that. We do have frequent, routinely scheduled kinship care support groups. So I know that they are well attended and that they are well supported. That doesn't mean that they're meeting everybody's requirements and everybody's needs. So I'm happy to discuss more about that with you, or meet with people to actually hear their thoughts and views to see how we can go about improving the experience more, because you're absolutely right. Kinship carers are such a critical and such a valuable support for our children in Falkirk. So we know that we really need to be scaffolding and supporting as much as possible. And there is obviously an age element to that as well. So yeah, I'll be really happy and really interested to talk to whoever you point me in the right direction of.
Thank you very much for that.
Okay, thank you so much. So if there's nothing else, we'll come to the recommendations then. So we're asked to note, we have commented on the report, and to acknowledge the commitment, skills and experience of social work staff in continuing to deliver services in, as we've heard, challenging circumstances. Is that agreed? Okay, thanks so much, Sarah, for the report. Move on then to communications and engagement update. Paul.
Thank you very much and good morning. So as you'll know, I'm here to present the quarterly update, which provides ongoing monitoring of the implementation of the partnership's communication and engagement strategy and its associated joint action plan. So the content of this update covers the period October to December 2025. During this period, the partnership received at least 22 pieces of media coverage, totaling a reach or opportunities to see value of over 380,000. The coverage received was from the Falkirk Herald, the BBC News and Scottish Housing News, and coverage in the period focused on the partnership's success at regional and national awards, the 16 Days of Activism Against Gender-Based Violence campaign, and the work underway within Housing with Care. So while the partnership did not have any active consultations during this period, we did attend various groups at the Carers Centre and the Third Sector Health and Wellbeing Forum to begin early discussions about our upcoming engagement opportunities, which leads me on neatly to flag that our budget consultation, as Marie mentioned earlier, has launched this week and is open until the 16th of February. As usual, a survey is open on Participate Plus, and we are engaging in person with stakeholders through meetings, drop-in sessions and local libraries, and within the services affected by the proposals in the consultation. And you'll know, as discussed earlier, that we've issued more than 5,000 letters or emails to invite those who may be impacted by the proposals to take part as well. Internally, the partnership and the council held an employee engagement survey throughout November, which gathered views on what it's like to work in local services. The overall results of that are due to be published today. I actually think they've been published while they've been in this meeting, and services like the partnership will then share the drilled down results with their own staff shortly after. There's a full list of coverage received and events attended during this period, provided at the end of this report. And that's it for me. So I'll return us again to the recommendations, which are just to consider and comment. Thank you very much.
Thanks, Paul. Other comments or questions from members? Councillor Hannah.
Thank you. Thank you for this report. It's always really interesting, and it's good to see some of the more positive stories that come out. I would just wanted to say thank you for the reference to the 16 days of activism. I think that was a really important, and it was a very, very successful event, probably more successful than any I've seen before. That was held, and so thank you to all the staff who were involved in that. Gender-based violence is something that's really, really important and has to be highlighted. So thank you for that.
Okay, thank you. Any other comments or questions? Okay, not seeing any, so we have considered and commented on the report. Thanks, Paul. Good report as always. Some great work in there. Okay, moving on then to item 10, which is the assurance report from PAC Committee. Ewan, I think you're going to lead this one.
Thank you, Chair. PAC Committee met on 16th of January with a full agenda of business as set out in Appendix 1, which were all considered and discussed in detail. The committee agreed they were assured and wished to highlight the following matters to the IJB. Firstly, in relation to the strategic risk register, PAC sought assurance around specific actions being taken to mitigate identified risks and noted ongoing review of the strategic risk register will seek to ensure that the progress and impact of specific controls are more clearly reported. In relation to the National Report and Inspections Overview, PAC commended the team at Bunbury Bray Care Home for the recent very positive inspection and passed on congratulations to the teams, noting the excellent grading for supporting people's well-being. In relation to the National Report and Inspections Overview, PAC also discussed themes for improvement, including through a range of inspections and sought assurance around processes in place to ensure wider learning in respect of areas of good practice. In relation to the Alcohol and Drug Partnership Strategic Needs Assessment update, the PAC considered and discussed in detail the complexities and interrelationships across community and services identified through the Strategic Needs Assessment. And in relation to the deep dive into prison healthcare, PAC noted assurance received regarding prison healthcare through a deep dive which covered outcomes of recent inspections, including examples of good practice, and thanked staff for all their work. And also in relation to that deep dive, PAC highlighted concern around the sustainability of recurring resources in prison healthcare as a result of challenges currently being faced, including overcrowding, diversity of needs in the prison population, and required changes in practice around mental health assessments. Thank you. I'm happy to take any questions.
Thanks, Ewan. Councillor Hannah, as Chair, is there anything you wish to add?
I think that was a fair assessment. I would just like to emphasise the deep dive into prison healthcare and the work that is involved there. Staff are working in extremely challenging circumstances across prisons across Forth Valley, and doing a sterling job. So I do think it's worth members of the IJB having a look at that and looking into and understanding the nature of it, because I certainly understand a great deal more about it after having read the report and listened to the comments. It is a hugely challenging piece of work to be dealing with overcrowded prisons, where the vast majority of people are themselves suffering from damage and victimisation of various sorts.
Yeah, couldn't agree more. It is a big issue in Forth Valley, and we know that the numbers we have in our prisons are increasing, which is putting even more of a strain on those services. But there is some great work going on. Okay, any questions or comments, colleagues? Nope, not seeing anyone. Can we note the assurance from the PAC committee then? Okay, thank you. So before we take the final item of the day, my instinct as chair is always to take as much of the business as we have as possible in public, but because of the nature of this report and dealing with commissioning and contracts, we have to take it in private. So can I ask that the committee agrees that we just take a short adjournment while we ensure that press and public are... Sorry about that. Yeah. Can I just ask that we agree to exclusion of the press and public for the final report and then take a short adjournment just to make sure we have that set up? Okay, just a 2-minute adjournment.